All right, so picture this. You roll up on a trauma scene, sirens are blaring, you're ready for anything, you know, the drill. But then you realize your patient is pregnant.
Yeah, it definitely changes the game when pregnancies involve all those trauma assessments. We know all the protocols, everything's still applicable, but there's a twist.
Right, because now we're not just treating one patient, are we?
Exactly. Now you've got two patients, each with their own very specific needs.
And that's what this deep dive is all about. We're really digging into trauma in pregnancy and intimate partner violence today. And I gotta say, some of this stuff was pretty eye-opening.
It really makes you think about all the ways pregnancy just throws a wrench into our usual assumptions about trauma. Like take blood loss, for example.
Okay, yeah, because a
Yeah.
pregnant woman isn't dealing with the same blood volume as the rest of us, is she?
Not at all. By the third trimester, her blood volume could have increased by almost 50%. That's a lot of extra fluid in there.
Wow. So she could be bleeding externally what looks like a normal amount to us, but internally it's a whole different story.
Exactly. And that's just one example of why assessing and treating have to happen almost simultaneously for both mom and baby. It's a delicate dance.
Like juggling two emergencies at once. You're managing mom's injuries, but you also have to make sure baby's okay. Speaking of which, this guide talks about something called supine hypotensive syndrome. What is that exactly?
Okay, so imagine this typical trauma patient on their back standard position, right? But after 20 weeks of pregnancy, that's a big no-no
Really? Why is that?
because the weight of the uterus can actually compress a major vein that carries blood back to the heart, and that's what causes supine hypotensive syndrome.
So we always go with the left lateral tilt after 20 weeks. No exceptions.
You got it. Even if you have to get creative to keep her stable and tilted, it's vital. You're securing two lives with that simple adjustment.
That's incredible. See, this is why I love these deep dives. You never know what little detail can make a huge difference out there. Okay, let's switch gears a bit. Let's say we get a call about a pregnant woman involved in a car accident. What are we thinking about with blunt force trauma in these situations?
Well, the thing about blunt force trauma in pregnancy is that even impacts that seem minor can have major consequences.
Because we can't always see the damage, right?
Exactly. One of the biggest concerns is placental abruption.
And just so we're all on the same page, can you break down exactly what that is?
Sure, placental abruption basically means the placenta is detaching from the uterine wall, which can be partial or complete. And that's a huge problem because it can cut off the flow of oxygen and nutrients to the baby, not to mention lead to severe bleeding in the mother.
So even if there are no visible injuries, this placental abruption could be happening internally.
Exactly. That's why a thorough assessment is crucial, even if mom seems okay at first glance.
So we're talking close monitoring, fetal heart rate checks, the whole 9 yards?
Absolutely. You got to be extra vigilant looking for
Oh.
any signs of trouble. Now, let's say this same patient also experienced some penetrating trauma during the accident.
Oh, wow. Okay, so now we're talking about a whole other level of complexity.
It definitely adds another layer. What's interesting is that in early pregnancy, the uterus can actually act as a shield, protecting the fetus from penetrating trauma.
Oh, really? I would have thought it would be the opposite.
It makes sense when you think about it, but as the pregnancy progresses and that uterus gets bigger, it becomes much more vulnerable.
So the location of a penetrating injury becomes even more critical as the pregnancy goes on.
Exactly.
Yeah.
You've got to consider the position of the baby as well as the mother's organs.
And of course, we can't forget about falls.
Right, they might not seem as dramatic as, say, a car crash,
Yeah.
but falls are actually one of the most common causes of trauma in pregnancy.
Which makes sense when you think about it. Your center of gravity changes. You're not as steady on your feet, and you might not react as quickly if you trip.
Exactly. And just like with blunt force trauma, even what seems like a minor fall can lead to those serious complications.
Placental abruption, all that.
Exactly. So we always have to err on the side of caution.
Thorough assessments are key no matter what. So we've covered a lot of physical trauma scenarios. But this guy also goes into something that's really important, but not always easy to talk about: intimate partner violence, or IPV.
Right. And it's something that we as first responders, unfortunately, we need to be prepared to address.
Absolutely. Because trauma in pregnancy isn't always accidental, is it?
Sadly, it's not.
Hmm.
And for many women, the most dangerous place isn't out on the street. It's in their own home.
That's a tough reality. So how do we as first responders get better at recognizing those signs of IPV, especially in a situation that's already so high stress?
Well, one of the most important things is routine screening.
Okay.
This guide really emphasizes that asking every pregnant patient about potential abuse, even if there are no obvious signs.
Makes sense.
You'd be surprised how many cases go undetected without that proactive approach.
It's about creating that safe space for them to open up, right? Even if they might not volunteer that information at first.
Exactly. And it's also about knowing what to look for.
Because it's not always going to be a black eye or a broken arm, right?
Right. It's not always obvious.
Yeah.
Beyond the physical signs, like bruising on the face, neck, or abdomen, you also have to be aware of behavioral cues.
So what kind of behaviors are we talking about? What should we be looking for?
It could be anything from seeming anxious or withdrawn to being overly cautious around their partner. Maybe they hesitate to answer questions or defer to their partner for the answers.
So those subtle things can actually tell us just as much as a physical injury.
Absolutely.
We really need to trust our gut on that one. If something feels off, it probably is.
I totally agree. Even a hunch that something's not quite right warrants further investigation. And this guide actually gives some really clear steps on how to navigate that whole process.
Okay, so let's say we're in that situation. Our gut is telling us something's wrong. What do we do? What concrete steps can we take to address potential ITV?
First and foremost, documentation is key. Every single detail matters.
If I imagine that's even more important in these cases.
It really is. We're talking about the patient's account of what happened, descriptions of any injuries, photographs if possible, and with consent, of course. All of that can be incredibly valuable later on, both medically and legally.
And obviously the patient's immediate safety is the priority. But what about the long term? Where do we even begin to connect these women with the resources they need to break free from that cycle of violence?
That's where this guide really shines. It lists local shelters, support groups, legal aid organizations. It's a whole network of support that a lot of these women don't even know exists.
So it's about being that bridge for them, right?
Exactly.
Yeah.
Our job is to bridge that gap and empower them with options.
Because you're right, they might not be ready to leave that situation.
Right.
But just knowing there are people out there who understand and want to help, that can make a world of difference.
Exactly.
Yeah.
And that's where that trauma-informed approach is so important. Approaching these conversations with empathy, without judgment, that can be incredibly powerful.
It's about giving them the power to make their own choices, even if it's tough.
Exactly. We offer support, we offer options, but ultimately it's their decision.
And sometimes that's all it takes, just having that support, knowing you're not alone. But this guide also mentions the legal side of things, which can be tricky. There's talk about mandatory reporting. What's the deal with that?
Right. Well, that's a huge part of our job as first responders. We have a legal and ethical obligation to report suspected abuse, especially when children are involved.
Of course.
The specific rules might vary depending on where you are, but it's crucial to know what those are.
So it's about finding that balance, right?
Exactly.
Between doing what we have to do legally and still maintaining that trust with the patient.
Absolutely.
Yeah.
We never want a victim of IPV to hesitate to call for help because they're afraid of what might happen.
Right. That would be the worst case scenario.
Exactly.
Yeah.
It's definitely a delicate situation.
Yeah.
But that's why training and resources like this guide are so important.
It's not just about knowing the protocols by heart. It's about understanding, the weight of these situations and responding with both expertise and empathy.
Couldn't have said it better myself.
It's a lot, but that's what makes our work so vital.
Well said. This deep dive has really highlighted the unique challenges and responsibilities we face as first responders, especially when we're dealing with trauma in pregnancy.
Absolutely. We've covered so much ground, from those physiological changes to the hidden dangers of IPV to the balance of providing compassionate care while navigating all the legal stuff.
And remember, this is just the start. This deep dive has given you some essential knowledge, but the learning never stops.
It never does.
Take this information back to your team, share it with your colleagues, and keep the conversation going.
Because ultimately, we're all in this together. We have a responsibility to be there for the most vulnerable, to be a voice for those who might not have one. So as we wrap up this deep dive, we'll leave you with this. What more can we do both individually and as a system to shift from just reacting to trauma and IPV to actively preventing it? It's a question worth thinking about, and one that needs our attention and action. Thanks for joining us on this crucial deep dive. Stay safe out there and keep making a difference.